let's talk about communication techniques for people living with dementia. So just to be clear, all the information presented in this video is for informational purposes only. I'm not trying to diagnose anybody or tell you that you do or do not have any sorts of diseases or anything like that. I'm just giving a lot of information based on the experience that I have in working in non-medical home care, in skilled nursing facilities, personal care, memory care. I've come across a lot of people that I feel like the information here that we're going to talk about, they found very helpful, and I hope that you do too. So, why are we talking about all this? My name is Jessica Spiroff. I am a certified dementia practitioner. I'm also a certified therapeutic recreation specialist and a member of the Aging Life Care Association. So right now I work at FEMA Home Care, and we provide non-medical home care services to people in their homes, wherever that is. If it's a private dwelling, if it's assisted living, personal care, skilled nursing, memory care, 55 plus, hospital, anywhere that people live, we can provide non-medical services. Now, before this, I have experience working in skilled nursing facilities and personal care homes. In a personal care home, I was the memory care director, and I absolutely love helping people with dementia and their families try to figure out how best to communicate with each other. I really think that people want to do the right thing, they just don't always know what that is. And a lot of times they struggle with how best to do that and maintain the dignity of the person that they're trying to support. So I really love helping older adults, especially those with dementia and their families, which is why we're having this conversation here today. So what do you think you know about dementia? Just something to ponder in your head, right? What do you actually think you know about it? What do you think you know about Alzheimer's disease? What is it like to visit someone with dementia or visit someone with Alzheimer's disease? And then also, what difficulties do you find yourself having in communicating with people with dementia? A lot of the things we're going to talk about here today are things that I've seen firsthand of families and friends having a hard time dealing with when they're visiting someone with dementia. So let's start off with, what is dementia? Dementia is not a normal part of aging. So not everybody turns 80, 85 years old and gets a diagnosis added to their chart that, yes, now you have dementia, right? We've known plenty of people who have lived well into their 80s, 90s, over 100, that are completely alert and oriented, no confusion, no dementia diagnosis. So it's not a normal part of aging, but that doesn't mean that it's not very common. So we have a lot of people who are experiencing symptoms of dementia and have dementia diagnoses, but that doesn't mean that it's normal. Dementia is the loss of memory and other mental abilities that affect daily life. So these symptoms can include and affect language, judgment, spatial perception, visual perception, and memory. Memory obviously is what we think of most often, especially with Alzheimer's disease. But dementia is this big umbrella term for all these other diagnoses that fall under the criteria of dementia. So what kinds of dementia do we have? Most of you have probably heard of Alzheimer's disease. That is the most common. There's also vascular dementia, there's Lewy body dementia, frontotemporal dementia, alcohol-related dementia, which is Korsakoff syndrome. There's Binswanger's, there's mixed dementia, PICS, all sorts of different dementias. There's a lot of different diagnoses that can fall under this huge umbrella term of dementia. So let's talk about Alzheimer's disease first, because that's the most common one, and people often confuse them, right? People will often say, yes, my mother has Alzheimer's disease, when in reality, maybe they didn't get diagnosed with Alzheimer's disease, maybe they have been diagnosed with general dementia, maybe they don't have a specific diagnosis of Alzheimer's disease. Alzheimer's disease is very specific. Like we said before, it is the most common. So about 5.3 million Americans are currently affected by Alzheimer's disease. Almost 2/3 of Americans with Alzheimer's are women. A lot of that is attributed to the fact that women live longer. So the disease, if it's going to happen later in life, oftentimes is going to affect women more often than it does men. It's also the 6th leading cause of death. One of the things I really find interesting about Alzheimer's disease is that it's the only cause of death in the top 10 in the United States that cannot be slowed or cured. So it's not cancer, it's not heart disease, not that all of those diagnoses can be fixed on every person, but there are cures and there are preventative measures we can do for those things. But Alzheimer's disease doesn't have that option. And again, just because dementia and Alzheimer's disease are common does not mean that they're normal. So what are some symptoms of Alzheimer's disease? If you've known someone with Alzheimer's disease, you notice that they're very forgetful, right? Memory loss is the main one. They're especially forgetting recently learned information. So you might tell them that you're going to have chicken soup for lunch, and lunch is in an hour, and 20 times before then, they're asking you, what are we having for lunch? What are we having for lunch? What are we having for lunch? Every time that they ask, it's the first time that they're asking for them. It might feel like it's the 80th time for you, but for them, it's the first time that they're asking it. They don't remember that you've given them an answer. It's usually the most recent things that go into their brain that they tend to forget. Long-term things like where they grew up, their friends from childhood, their family, those things tend to stay in their brains a lot longer than the most recently learned information. They also tend to forget important dates and events. So maybe they always remembered everyone in the family's birthdays, and then recently they're not really remembering them at all, or they forget what date their grandchild was born. They might forget that, but they probably don't forget their own birthday because they've been telling that to people throughout their entire life. They might not forget the date they got married, but they might forget the date that they put on the calendar to meet up with their friend for lunch. There's also confusion. So that's a big one that we hear about with Alzheimer's disease, right? They can be confused on what day it is, what season it is, what they need to be doing. One of the things that you'll see often in people with Alzheimer's disease is dressing inappropriate for the season. So it might be the middle of winter, but they look outside and it's sunny and there's no snow on the ground. So they think, oh, it's sunny, it must be a nice day. And they're putting on shorts and a t-shirt and going outside, which is another reason that we have to be really careful with people with Alzheimer's disease, that we do monitor them and make sure that they don't wander off, especially if they're not in seasonally appropriate weather or seasonally appropriate clothing, right? So if it's the middle of winter and they're wearing shorts and a t-shirt, that's a problem. Also a huge problem if they go out in the middle of the summer and they wake up and they think that it's the winter and they're going outside in 90-degree heat in a parka. These are both problems that are going to cause issues for them if they're left outside unattended or if they wander away. They also have a hard time understanding things if they're not happening immediately. So you'll notice with people with Alzheimer's disease, if you tell them that whoever is getting married in 2 months, they don't really understand that because it's not happening right now. If you tell them, hey, don't forget we have a doctor's appointment next week, they're probably not going to remember that either because it's not happening right now. If you're showing them something that's going on immediately, they're going to have a much easier time understanding it. And most often too, we have people forgetting where they are or how they got there. You see this a lot of time in senior living facilities, in memory care, when people ask, where am I? Right? Where am I? This isn't my home. What am I doing here? And then a well-meaning family member will say, oh no, you live here now. That person with dementia and Alzheimer's disease doesn't realize that they live there. So every time you're telling them that, that's the first time. And think about, even though you or I would understand where you live now, for these people, if every time they're scared and they're in a new environment that they don't remember, and you're telling them they're going to stay there for the rest of their life and that they live there now, they're going to react intensely, right? They're going to be upset. They're going to be scared. They're going to be worried, angry, fearful, all the emotions. So it's something to think about when you're telling them, when you're answering, where are you, right? Where am I? Maybe instead of, oh, now you're in a memory care neighborhood. Now you live here forever. Maybe we tell them, oh, you're in Chester County. Oh, you're in Downingtown. You know, we can talk to them differently and see what answers work and which ones don't. But if they don't remember how they got there, that's a very scary feeling. Imagine the same thing for you, right? If all of a sudden you didn't know where you were, how you got there, you'd be very upset. People with Alzheimer's disease also have difficulty completing frequently performed tasks. So maybe their whole life they wrote checks, and all of a sudden they're having a hard time figuring out which line their signature goes on, how to write out the amount of money. They're having a hard time managing their money. They're having a hard time completing familiar recipes, right? Maybe they were always the person who made pumpkin pie or apple cobbler, and they could do it right like the back of their hand. They didn't even need the recipe. And now they look at the recipe and they don't even understand quite how to do it, or it just doesn't seem right to them. Things that were once very familiar to them, they have a really hard time with. Also, that leads us to difficulty with driving. So they can have trouble driving to a familiar place. All of a sudden, they don't remember how to get to their son's house. They get lost on the way and they think, oh, maybe I just turn up here, And then all of a sudden they're miles and miles from home and don't know where they are, don't realize how to ask someone for help, don't have a cell phone, don't know how to use it. So we really want to be careful of when is a good time to prevent these people from driving. We don't want to take things away from them unnecessarily, right? Like anybody else, that upsets people if you tell them that they can't do things. So there's different ways to do that, to have those conversations with people. But when you start to realize some of these things, it's a good time to start thinking about maybe the car doesn't stay at the house, maybe the keys are somewhere else, maybe the car's in the shop, maybe someone else needs to borrow the car for a while. Because the last thing you want is that person getting in the car, driving, not knowing where they're at, getting in an accident, hurting someone, getting lost. There's all sorts of problems, obviously, that can come with driving with people with Alzheimer's. People with Alzheimer's also have a hard time understanding visual and spatial relationships. So you also see people, right, not just older adults with Alzheimer's, but people don't like their furniture moved. People with Alzheimer's and dementia, they know where the things are in their home, right? They know that if they can just walk from one chair just to the other one and they can grab onto it, and that will be safe for them to keep their balance. If we're well-meaning and we realize that there's some clutter on the floor, we're going to move these things out, and oh, wouldn't it be easier if we move this chair over here a little bit? That's really, really hard for them. They're used to the way things are set up. When we change stuff around, it makes it very, very difficult for them. The visual and spatial relationships as well, if they can't quite tell, like their depth perception and their peripheral vision gets less and less as the disease progresses. So if they can't quite tell how far away something is and they go to reach for the arm of the chair, but it's actually a little bit farther, then they're going to reach forward, and then that's when we have falls happen. Same thing with other spatial abilities, right? If they can't quite sense how close someone is to them, if their peripheral vision is minimal, right? By the time end-stage Alzheimer's disease, you can really only see around here. You can't see past your the sides of your face peripherally. So if they can't see past that and someone comes up behind them and taps someone on the shoulder and they didn't even see that person, chances are it's going to be alarming to them. They're going to turn around, they're going to be scared. So we always want to make sure we approach people with dementia and Alzheimer's from the front. Just remember, they don't have that peripheral. It actually turns into tunnel vision as the disease progresses. So we want to make sure that we're seeing them from the front and we're not startling them from the side. We also have misplacing things. This doesn't mean that you can't find your keys. We all have days where we can't find our keys, or we don't know where our phone is, or I just saw that and I have no idea where it is now. That does not mean that we have dementia or Alzheimer's. This is more, you find the keys in the freezer, or you find ice cream in the cabinet. This is where the things don't make sense where you find them, and you don't remember doing that, right? You didn't put the ice cream in the cabinet because you had ice packs in there and you were trying to hide it from someone. There was no rational thought process of why the item wound up where it was. This is more, and people tell me about this, when they call and they talk about home care services, they'll say, yeah, I went over to mom and dad's house and I found the sugar container in the bathroom. And it's just stuff that just doesn't make sense. And it's not that it doesn't make sense. And then the person with dementia can say, oh yeah, I put it in there because I read about a new skin treatment that I wanted to use, right? There's nothing like that that is a rational thought for it. It just winds up there. And typically there is a reason that they're doing that. Another thing to take note of with people when they're misplacing things is that often that leads to accusations of stealing. So if they are used to having their keys by the door, and they misplace them, they put them under their mattress, they move them somewhere that they don't even really know where they wound up. Then when they go to look for them by the door and they're not there, they're worried. So they're calling you and saying, oh my gosh, somebody came in and they stole my keys, or I don't know what happened to these, you must have taken them. So those thoughts of accusations of stealing and things like that can actually be from a place that we can all understand. When something's not where you thought it was and you don't remember moving it, and you also don't think that anybody else has been in your house, that's where these accusations can come from. People with Alzheimer's disease also have new problems with words or speaking. So they might have always called it a watch, and all of a sudden they're asking you, hey, do you know where's my my wrist timer, right? Something that doesn't make sense. Or you'll hear a lot of the, oh, well, you know, the thing, the you know. And not just occasionally when we can't find our word, we have the experience of having the word on the tip of our tongue. It's not that. It's that they're unable to find those words in their brain to use them appropriately. You'll notice it more and more as the disease progresses, that they're not using the appropriate words for the appropriate things, and they can't necessarily find the appropriate words when they need to. Decreased and poor judgment is another sign of Alzheimer's disease. Everybody has the right to make a bad decision, right? People who are alert and oriented might choose something that someone else might not, but people with Alzheimer's and dementia have generally diminished judgment. So they might think that it's a good idea to try to stand up from their wheelchair and stand because they need to go to the bathroom. When in reality, they're in the wheelchair because they broke their hip and they're not supposed to be up out of bed without someone unsupervised, or they're not supposed to be up out of their chair without someone right there with them. But they don't look down and say, oh yeah, you know, I remember I just got my hip replaced, or I remember I just broke this. I shouldn't be standing up. Let me push my button and wait for assistance. Instead, they're thinking, I need to go to the bathroom. Let me do that. So there isn't the thought process of what they need to do and what they should be doing safely. This also comes down to hygiene. You'll notice men who are typically very clean shaven all of a sudden might start becoming more and more scruffy. They might not shave as frequently as they have been, might not take care of their personal appearance. Maybe they have always been ones to dress in dress pants and a nice top, and now all of a sudden they're not getting out of their pajamas. These are things that can happen with Alzheimer's disease and are also good opportunities to talk to the doctor about changes that you've seen with them. All of these changes can absolutely lead to withdrawal from social activities. So if you thought that you have people stealing from you, or you think that you don't look great when you look in the mirror, or you think that you're getting a little bit worried because you're not sure who's coming into your house and taking your things, you're probably not going to be going to the social events that you used to go to, which then is tricky because then you become isolated and you have less social interaction. But people with dementia and Alzheimer's disease do tend to minimize their socialization in the early stages of the disease. Alzheimer's disease also comes with changes in mood or personality. This is where we hear a lot of people say, "Oh, my mother said," and it's like some string of expletives, and it would be, "My mother would never have said that." People with Alzheimer's disease, one of the trademarks of that disease is the change in personality. So sometimes people who were once the most nurturing person in the world become very combative. People who were always very mean and stoic can sometimes become more gentle and fun and fun-loving. So the disease does change the personality when it comes to Alzheimer's disease. One of the nice quotes that I really enjoy is from Michael Verde. He's the founder of Memory Bridge. The quote is, "Dying brain cells don't cause pain. What really hurts, what threatens the very core of what it means to be human, is the way that people with dementia become cut off from their communities and loved ones." So people tend to not want to go visit people with dementia or want to not necessarily give them a call. We do tend to isolate them. Sometimes it's intended, but most of the time it's not. Most of the time it's that maybe it's easier to go do something and hang out with people who know who you are. But just thinking about how they can become disconnected from everyone else. This is another quote from him. "You don't need to know the day of the week to feel that someone respects you." We don't need to quiz these people when we see them. "Hey mom, it's me. Do you remember who I am? Remember what I said? When's my birthday? What day is it? What's your name?" We don't need to quiz them. There's no need for that. They don't get any reward for passing, and they don't get punished for failing. It just kind of can cause some friction while we're there. I think a lot of times people do this to think that they're helping, and it is always very well intended. People do it because they think, "Oh, I know he knows this. It's just on the tip of his tongue. If I can just keep him a little bit sharper." When you're at the point in dementia and Alzheimer's disease where you don't know that, you don't need to be quizzed on it. Even when, no matter how well intended it is, it can really set people up for uncomfortable visits and just generally being unhappy. So we don't need to know what their name is. We don't need to know what day of the week it is. We don't need to know what their history is. All we need to know is that they need to know that we respect them. So we still talk to them like a normal human being, right? We say, "Hi, it's so nice to see you. It's me, Jessica. How are you today?" That doesn't take a lot of effort, but it's significantly easier to say that than, "Hey, it's me. Do you remember my name?" Like, that's a lot of pressure. It's a lot of pressure for people. I know I wouldn't like it if somebody came up to me, even alert and oriented, and asked me if I knew who their name was. It's always nicer and just easier for everybody if you maybe just say, "Hi, it's me, Jessica. How are you today?" It's just a little bit easier and still respectful. You don't want to call people, anybody really, but especially older adults, those with dementia, sweetie, honey, anything that could be demeaning to them. If they've always wanted to be called sweetie or honey, and that's been their nickname, by all means, use that. But if they've always been Mr. or Mrs., we call them Mr. or Mrs. If they've always been sir or ma'am, we keep with that. There's no need for us to change what we call them just because their physical and mental abilities have declined. We're still going to call them what they prefer to be called and be respectful when we talk to them. We'll talk slower and we'll give them fewer options, but we're not going to talk to them like they're children. They're not children. They're adults who have led a very full life and are looking for some meaningful engagement. They're looking to be respected. They're looking to feel included and useful and helpful. So we don't need to talk to them like they're little kids, but we do adjust what we say to them so that they can be successful. So instead of showing them their humongous closet and saying, "Okay, what do you want to wear today?" That might be a lot of choices for them. Maybe instead of that whole closet, we pick out two things. "All right, would you like your red shirt today or your blue shirt today?" They can pick. Life is good. They've made a decision. They feel empowered with that decision. You've picked out seasonally appropriate clothes that they're going to be successful at wearing, and they have the option to make a choice. It's little things like that that can really make the tasks associated with regular living, more fun, less stressful, and more empowering for the person with dementia. We want to treat other people the way we want to be treated. It's so simple to say, but especially people with dementia, it's too often that that's not the case, that we're treating people like they're children, and no one wants to be treated that way. So we need to talk to them with respect. We need to be empathetic of what they're going through. We don't want to pity them. Nobody likes that feeling either when someone comes up to you and says, oh, isn't that a shame that whatever happened? It's not a good feeling. Instead of talking to them like that, you can say, oh, wow, I realize that fill in the blank happened. That has to be really hard. I would think that that's really hard for you. Tell me about that. Or I can imagine how you feel. Something like that is a lot more human and kind than looking down at people with dementia and talking to them like they don't understand or that they don't have feelings. They have feelings the same as the rest of us. They just can't express them the same way that we do. So when you're spending time with someone with dementia, it's hard. It's a lot of hard work. They don't think the same way as us. They don't do things as quickly as we want to, in the same manner as we want to. It really takes a lot of patience. They can also seem really rude and impulsive and say things that are hurtful. People who have never used any foul language in their life can have quite the colorful vocabulary when it turns to dementia, but that's not them, that's the disease. So we need to remember that as hard as it is when it's coming at you, it's not them talking, it's the disease talking. So if you are taking care of someone with dementia, or a family member of someone with dementia, or a friend of someone with dementia, know that you're doing a great job. Trying to educate yourself is a fantastic way to start feeling empowered and help that person. So I always tell caregivers, especially the people who are in the trenches, right? They're the main contact, they're the spouse, the child, the best friend. You're doing a great job. And to be friends with, volunteer with, work with someone with dementia, you have to be patient, you have to be empathetic, you have to be kind, you have to be very creative, you have to be able to change what you're doing on a moment's notice. You often have to have very high self-esteem because there are a lot of things that can be said that could otherwise be hurtful, but if we have high self-esteem and we realize that it's the disease talking, not the person, we can deal with that. You have to be able to be an active listener, be optimistic, realistic. Sometimes those don't go hand in hand. And also being able to communicate effectively. So not only are you communicating effectively with the person with dementia, you're also communicating effectively with the rest of the team. So that includes family members, friends, other people who are caring for them, caregivers, nurses, therapists, doctors, senior living community staff, anybody who's coming into contact with them. We want to make sure that we're sharing with them things that we know work and things that we know don't work. When you go to the doctors, make sure that you're having a written explanation of what happens when, what their typical daily routine is, if they've been having any sort of behaviors, what the instigating factor might be for that, how they react to different situations. But where I'm going here is that caregivers are really wonderful people. Even if you don't consider yourself to be a caregiver, but somehow now you're caring for someone or you're in charge of making all their appointments and taking them to them, you have a lot of these traits, if not all of them. That doesn't mean they're always shining through. We all are human, but it seems like everyone's doing a great job. So just something to think about, all those traits that you do have. So other common communication difficulties that people have told me about is that when they're trying to talk to someone with dementia, the person with dementia repeats the same thing over and over again. Their answers to the questions that we ask them are wrong. Hey mom, what's my name? And they tell you the wrong name. What's the date? And they tell you the wrong date. We don't need to argue with them, but still it can be really frustrating for people who want a right answer or who know that 10 years ago dad would have given them the right answer. That can be really, really hard. It's also hard when they ask to go home. That can be a really tricky situation for a lot of families. It can be hard when they don't say anything at all. I've had residents like that where I spend time with them and they don't talk. Sometimes they can talk and they choose not to. Sometimes they can't talk. This is a good opportunity to hold hands, to have a hug, to watch something together, to look through photographs. There's other things you can do, but it makes a lot of people really uncomfortable to be around someone who can't communicate with you. Sometimes it also feels like it's the never-ending visit. It can be that you're getting bored after 20 minutes and you don't know what to do and you feel like you should be there for 3 hours because when this person was alert and oriented, you would have spent 3 hours together. Also, just not knowing what to do with them. You say you go and you sit there and grandmom doesn't talk to me. It can be very, very awkward and also painful, especially when they don't remember who you are. So here's some things to help with that. Phrases that I like to tell people. It's their world. We're just living in it, right? So if they think that it is 1985, we're going to go with that. We can talk to them about what's happening in 1985. Does it really matter? When they say something that's not true, does it really matter? Why are we correcting them? Is it to make us feel better? Is it to make them feel better? Who is it benefiting? Are we taking them out of the senior living community to come home for a big event so that they're there and that we know that we've included them, which is a very well-intended event, but also can be really, really stressful for the person with dementia. When people have dementia and Alzheimer's disease, change in scenery, change in location, being out of their familiar environment can be really hard. It's hard for people who don't have dementia to change and have a lot of transitions throughout the day, but especially people with dementia, to change their environment is very hard. And then to change an environment to be around a whole bunch of people that are loud and celebrating, and they're in a house that they maybe don't remember. And instead, the other option is for them to stay in their apartment where it's quiet, it's just them and they know what's going on. We tend to want them to come and interact with us because we love them and want to spend time with them, but it's just something to think about. Who's it benefiting, and is there some adaptation we can do to make it more enjoyable and successful for everyone? Maybe instead of bringing that person home for the holidays, maybe we have everybody pick a different day and different family members go to visit them one-on-one over a couple weeks. And it's only for, maybe 20 minutes, maybe an hour, but it's a little bit less stressful if that's appropriate for that person. Also, remember, everyone's trying their best. I've worked with a lot of people who will say, my fill-in-the-blank family member doesn't know what they're doing. They always ask what's going on, or they always say that, no, mom doesn't really have a problem. Most people really are trying their best. That includes the person with dementia. It includes you, it includes me, it includes the caregivers, the doctors. It can be really frustrating, but just something to try to remember is that everyone's really trying their best. And people with dementia cannot change their behaviors, but we can change ours. So here's some things that we can say. We want to say, tell me about fill in the blank. Tell me about your mom. Tell me about your dad. When they say, oh, I miss home. Tell me about your home. What's it like? Not what was it like, or you don't live there anymore, or isn't this place great? Tell them about it. Ask them to tell you about it. See what happens. Another great phrase that I use a lot is, I'm sorry. It doesn't mean you've done anything wrong. It doesn't mean that the person with dementia has done anything wrong. But if you have done something that they find offensive, you've upset them in some way, food's wrong, you weren't there when you told them they were going to be there, when in reality you told them that you would be there at 3 o'clock, you're there at 3 o'clock, but they thought that you were going to be there earlier, I'm sorry. And not a fake I'm sorry, but a real, genuine, I'm sorry, we must have had a miscommunication there. I'm here now, what can we do together? I'm sorry really does solve a lot of problems. And it doesn't mean that you're insincere, and when you say it, it means that you're genuinely, you're sorry. You're sorry that we're here, right? Also, it's okay. It's okay that you think that it's right to do all these techniques that you think are going to help and they don't. It's okay. It's okay that you think the right decision is to keep them home. You think the right decision is to move them into memory care. It's okay. Everyone's just trying their best. What we're not going to say to people with dementia, your mom's dead, remember? People do this well-intended to try to bring that person back to reality, but we don't need to do that because clearly they don't remember. If you have to add the phrase on, don't you remember? They don't. So there's no need to remind them of something that was probably very painful for them. We're not going to tell them this is their home now. We're not going to do that. I already told you that, because they don't remember that. We also need to be aware of how we talk to them, so we don't need to tell them to sit down, right? They're not dogs. They're not animals. It's not sit down like I told you. Maybe it's, oh, sit down over here. Or if we're worried that they're getting up too quickly, oh, do you mind having a seat for me real quick? Or can you sit with me? Just the way that we phrase it can have people do what we want or have them get really annoyed and really agitated. Thinking about what the phrases accomplish before we say them, right? If we say, don't you remember? If you have to say that, they don't. So we don't need to say that. Think about who the phrase is benefiting and who it might be hurting. What do these phrases accomplish? Do they make the visit more enjoyable for everyone? If you apologize for getting there late when you're right on time, does it make your loved one feel validated and set them up for a good experience to have the rest of the visit? Or does it make them mad because they never were one to take apologies well, right? You need to think about these things before you do them. So some other communication suggestions, obviously being respectful, right? We talked about this a little bit before. You don't need to know the day of the week to know if someone respects you. We're going to call them by their appropriate name, what they want us to call them. They might, like I said, be a Mr. or Mrs. I've also had people who have said, I've been Mr. Smith my whole life and now I just want to be John. Either thing's fine, but whatever they want to be called, that's what we're going to call them. The same technique will not work all the time. You might find that today you are able to have a nice visit and then tomorrow it's the same exact thing. You come in the same way at the same time and that person is very mad at you. Not that you did anything, but they're just very mad. So the same time, the same place, the same day of the week, all these things don't always mean it's going to work or not work. Another interesting thing is to ask people with dementia how old they are. You might know that they're 95 years old, but if you just casually ask them in conversation, oh, hey, I forget, how old are you again? They're probably not going to say 95. They might say they're 60. They might say they're 40. We're not going to correct them if they tell us that, but it gives you an insight into where they're at in their journey. So if they say that they're 40 years old and you bring in someone who's 5 years old and say this is your great-grandchild, they're going to say there's no way. I don't have a great-grandchild. I'm 40 years old. So instead of introducing whoever it is as a great-grandchild, maybe we just say, oh, this is Johnny. Right? That's easy enough. They're still visiting, but we don't need to confuse them. But we're still having a quality visit there and some quality interactions. So asking them how old they are every once in a while can give you some insight into what's going on in their world. Also, if they think that they're 40, do the math. If they were 40 in 1980, then what's the popular music in the 80s? They're not going to like something that came out in 2000. They're going to like what was popular maybe when they were teenagers, when they were 20. So go back and say what was popular in the 60s and 70s, right? You can do all those things and figure out what's going to be effective for them and meaningful for them as well. So before you visit with someone with Alzheimer's and dementia, prepare. You don't want to just go in and think that it's going to be like it is most of the time. You know, it's not going to be what it was when you were growing up, when you were even 5 years ago. You want to prepare. You want to have expectations that are basically, I'm going to visit. You don't want to have elaborate expectations because you might be let down. Prepare yourself for anything. If you talk to friends and family or any support groups of people who have loved ones with dementia, I'm sure people can tell you some very interesting stories about what has happened when they visited. I have some interesting ones that people have told me over my time of their visits with them, but I'll leave everyone to discover their own. Also, decide on an appropriate environment to visit. Maybe it's best that you visit in their apartment in their living room where you've always had visits. Maybe they need to get out of their apartment and you walk down the hallway a little bit. Maybe you visit with other people, right? Maybe they've made a new friend that they don't want to be away from. Maybe you visit with that person, or maybe you are visiting them in a memory care. And like we said before, you're visiting them at the main table and you're visiting before lunchtime so that you have an easy time to get out of there. Thinking about who else is around. Maybe some staff could help you if you ever feel like you're uncomfortable and you need some additional support. Then maybe you visit in a common area. If you feel like you need to have some more private conversations, you visit in their apartment or their room. You don't want to have the radio on, the TV blasting, your cell phone going. You know, you don't want to have all the extra noise. That can be very, very overwhelming to people with dementia. Most of us can tune out a couple things, but for them it can be very overstimulating, and then they certainly can't concentrate on what you're telling them. And again, like I talked about, we want to make sure that it's not too private and not too overstimulating, depending on where you want to visit. Thinking about what time you're going to visit. Is it best? Are they always been early birds? They're really great to talk to at 7 o'clock in the morning, or are they people who like to sleep in and don't talk to them until they've had their coffee? You want to think about those things on when you're going to visit them. Are you going to visit them on a Sunday after you've gone to church and they're not able to go to church, but they recognize the outfits that you wear for church, and then when you see them, they're going to be upset that you went to church without them and feel like they need to get up and go? These are all things that we kind of need to consider, but also you're never going to consider all of them before they happen. So just things to think about. If you have a visit that leaves room for improvement, go home and think about what was the environment, what were we coming from, where were we going. You can also plan some options. I used to have, when I ran a memory care neighborhood, I used to have a client and her daughter would come in every day and she would stay for maybe like 15 minutes, and she would bring her mom a cup of coffee from Wawa, and they sat there and they talked, and she didn't think that she was her daughter. She thought she was her friend because in her mind they were the same age, and they sat and they drank their coffee and they watched the other residents. They talked for a little bit, and then she'd get up and she'd say, okay, well, I'll see you again. And she'd say, okay. And then off she went. And that was their visit. And it was beautiful. I mean, it was such a great option for a visit because she got to spend time with her mom. No one was stressed. She knew her mom liked coffee. It wasn't a very deep, meaningful conversation visit, but you're not going to get a lot of those anyway. So having a visit that's not stressful, that people enjoy, is nice. You could take coffee, you could take snacks. I've seen people take nail polish and they paint their loved one's nails. You could take greeting cards. Maybe you have some events coming up and you can just get them to sign love whoever on them, and then maybe you have some greeting cards you can send to family for the next year. You can take coupons, you can take the newspaper, have them help you cut out newspaper coupons. Photo albums are always fun to look back through. Make sure you know how old they think they are before you do that. So don't put in pictures of them when they're 95 years old. They're going to say, who's this old person? But put in pictures of them maybe when they're 40, 50, and they know the other people in there. Another option is to take art supplies. Maybe you do some crafting while you're there. Maybe you're trying to learn a new talent. Maybe they were really good at painting and maybe they don't get the chance to do that anymore. Maybe you go and say, hey grandma, I'm working on this project for school. Could you help me with the painting part? I would really love your help. Maybe it's not what they would have normally produced, but it's something that they're helping you with and they feel useful, and they are useful because they're teaching you something. They also make, you can get them like online, but boxes of conversation starters. Some of them are really fun. Some of them are just like a would you rather do X or Y. Some of them are, what was the best time you had, fill in the blank. But those can be really fun, and some of their answers are pretty funny. So you could do that. You can write down some of their answers if you think you're going to get some comical ones. You could take a little recorder, you could take your phone and record some of their answers, because some of them are quite entertaining. What was the best day of your life? I ask people that often. A lot of them will say their wedding day. But it's nice to hear that, right? Because their spouse might visit, but maybe their spouse doesn't ask them that, or feels like they're neglected and that they don't know who they are anymore. And then here you have a video or an audio recording of saying, hey grandma, what was the best time in your life? And she says, oh, when I married my husband. Little things like that. And especially having a voice to listen to as people get older and pass away, the voice is a wonderful thing to preserve. Music is another great thing that you can take with you. Again, figure out what's important to them, what kind of music they liked, or maybe even you're taking some new music that you say, hey, can you give me your opinion on this? This is a new musician, a new band that I really like. What do you think? And they'll probably hate it, right? Asking for advice is one of my favorite things to do. If you really have a problem and you ask someone with dementia, you tell them a little bit about it and you say, what's your advice? Or can you help me? The things that they come out with are actually genuinely very helpful. Maybe they'll just say to you, just do your best, or well, just treat other people the way you want to be treated. It's usually just what you need to hear. Or maybe they'll say, it's not important anyway. It's always nice to ask them for their advice, and a lot of the time it is something you need to hear. Lastly, one of the suggestions I have for visits is taking pets with you or children. Again, not quizzing them on, hey, do you remember who this dog is or who this kid is? But, oh, hey, here's my dog, whatever the dog's name is. And, oh, she would love to see you. Thank you so much for the nice pets. Or, oh, look, here's little Johnny, and he would love to see you. He wants to show you something that he made for school. Children and pets really do tend to make people happy. Obviously, if they like pets and they like children. Also, when you're there for the visit, you've got your plan, right? You get there, you want to talk slowly, which I'm not doing. I'm not very good at that, but you want to talk slowly and clearly without your hands covering your mouth, because that's really hard for them to understand, which makes it hard when we're wearing masks. COVID was really hard for people to understand what their practitioners and their healthcare providers were telling them because they couldn't see their mouths. You want to pause between topics to give them time to understand what you said. It can take them up to a minute to process what you said. So once you say something and they're not responding, they're probably not ignoring you. They're just still processing. A minute can be a long time. It feels like a long time after you ask them something, but it's them thinking about what you've said. You don't need to argue with them. Another great word I love is okay. Oh, I really want to go to the mall. And they haven't been to the mall in years. Okay. Right? Okay. Yeah, I really like the mall too. What's your favorite store at the mall? You don't need to be afraid to do the same thing every day. If every day you take in a cup of coffee and you look at the newspaper, and the newspaper is 2 weeks old, and every day there's an article in there that makes them smile. Oh, did you see? Look at this. On the front page, there's a story about a beautiful double rainbow over the bridge. Did you see this story? If you bring in the same newspaper every day and you drink the same cup of coffee every day and they are happy every day, that's okay. You also need to be afraid to try something new. It's really a lot of putting yourself out there and thinking, okay, well, what we did yesterday didn't work. I'm going to try something else. And you're going to find a lot of stuff that does not work. And you're going to find some things that do. When you find the things that do, share them with other people and keep going with them. Try new things. But it does take a lot of patience, a lot of creativity, a lot of self-esteem, a lot of confidence to just try something new that might not work. And then again, before you leave, you have to prepare to leave. So we're not going to start putting our jacket on and putting our purses on and standing up. Because if you do that, they're going to start to stand up and try to look for their jacket and look for their purse and go with you. So you might just tell them you'll be back. You might need to not say anything at all. You might need to tell them that you're going to go to the bathroom. I used to have a resident, every day when I would leave, he would want to come with me. And I finally realized I would say, hey, I need to go to the ladies' room. And every time I said that, he'd go, oh, okay, I won't bother you then. And he would go the other direction. And then I was able to leave. And I would say, I'll see you again. And I'd come back the next day. But that was how I was able to leave. And it didn't bother him, didn't bother me. We were all ready to go. After your visit, remind yourself you did a good thing. You may have just been barely holding it together during your visit. You might have been ready to cry, ready to scream, but you did it. And you did a good job. If you did it every day, great. If you did it once a month, great. Whatever works for you, you're doing a great job. Remind yourself of that. Think about what went well and what you can do again and what maybe didn't go so well. And you think, oh, can't do that again. Or maybe I should have fill in the blank. Nobody's perfect. You're not going to do it perfectly. That doesn't make any sense. Nobody's perfect. But whatever you do that doesn't work, try to change it a little bit for the next time. So maybe, wow, I really should have said, I'm sorry, instead of arguing with her. Okay. And the next time you come in and you have that same conversation, instead of arguing, you start with, I'm sorry, I didn't mean for that to come out like that. Let me try it again. You can try that and see what happens. And also do something nice for yourself. You deserve it. You know, you're doing a good job, and taking care of and visiting people with Alzheimer's and dementia is very hard. Another thing we always encourage everybody to do is to get resources. So there's the Alzheimer's Association, the Alzheimer's Foundation of America, there's the Centers for Disease Control and Prevention, National Institute on Aging, there's a National Alliance for Caregiving, there's a lot of local support groups, there's in-person, virtual support groups, a lot of senior living communities have ongoing educational opportunities, ongoing support groups, friends and family at church, in the neighborhood. Don't be afraid to talk about it. If we don't talk about it, you don't really know who else is going through the same thing as you. So again, reaching out to friends and family is going to really be a great support system for you. We have a lot of resources here at Thema Home Care where we can point you to getting resources that are going to be best suited for you. And we're always happy to try to help you figure out how to best take care of your loved one with dementia. So keep up the good work, and we'll talk to you soon.